Yes. Well, actually, it all started about 12 years ago. They misdiagnosed me bipolar. They had me on bipolar medication, which also they had me on too much of it. It was 2,500 milligrams a day. So once my one doctor finally found out, she took me off of it. And that's whenever I started getting shakes a little bit, and they thought it was Parkinson's. After a couple stays in the hospital for about a couple weeks, they finally figured out it was dystonia. And that was very recent, maybe about 4 or 6 months ago. And the dystonia was very, very bad. I mean, I couldn't move, couldn't talk, my whole body would shake, I had to lose control of everything. It was horrible, non-stop shaking. Whenever it was really bad, I couldn't talk. I couldn't use my legs. My legs would give out on me. It was getting close to the point where I was actually getting ready to lose my job because they thought I was having seizures. Well, it started at AGH, an inpatient. I seen Dr. Jason Licklider, the neurologist. He seen me a couple times. He was trying different medications that wasn't working at all. And then he actually recommended coming here, giving this a shot. And he said if this didn't work, then the next step was deep brain stimulation surgery. My thoughts about the surgery was I really didn't want to do it. Much as I looked into it, they say it's a routine surgery, but anytime you go in your brain, I don't believe it's routine.
And what exactly did they want to do, Jaime?
It's called a deep brain stimulation. They actually want to put 2 quarter-size holes in my head and put stents in my brain to control the shaking. And I just wasn't going to go for it. They actually still kind of talking about it, but I got to see my doctor next month and tell him everything seems to be going well. I don't think I need a surgery because of coming here. I'll be able to control everything. So he actually give you guys a high recommendation to give this a shot and see if it actually worked for me, which it has been working great for me.
So let's talk about, if you'll back up a little and tell me before you came here, Jaime, on a scale from 0 to 10, where you were, where you are today, and talk a little bit about the treatment you're receiving here.
Where I was at probably about a 10. I mean, it was real bad, really, really bad. To where I am now, about 5 or less, I can actually control it due to the techniques that they taught me. I work through whenever I feel one coming. I can do the exercises and kind of work my way out of it, where before it was just kind of let it go and see what happens. Okay, the treatment is they do the tone of my ears, and that does a big difference. And also they taught me some exercises to do, some eye movement exercises too, which actually works very well too. Like if I combine all the exercises they taught me, I'm able to calm myself down pretty quickly.
Great.
I'm actually able to control them. Every once in a while I do have a little bit of an episode, but it's able to be controlled with all the techniques that they did teach me.
Great. If there's anyone who might be skeptical about chiropractic neurology, functional neurology, alternative medicine, Jaime, what would you tell them?
I would actually tell them this was my last hope before the surgery, and take a chance. I mean, it worked for me. It worked wonders for me. And my dystonia was so bad, I couldn't walk and I couldn't talk. I'm able to go to work now and actually function like I used to before they found out I had dystonia. So I would say give it a shot.
Anything, Jaime, I've overlooked that you would want to add about your condition, how your life has been affected, your treatment, the doctors, anything you'd like to?
So just whatever they teach you, the doctors, just do. I mean, sometimes whenever you're going, I understand whenever you're starting to have an episode, that's the last thing you want to think of. But just kind of push yourself through the exercises, and you will work your way through it with the exercises that is taught to you. So I could recommend is giving it a shot. It does work.
Thank you.